Well, what I do in San Rossore Hospital is to treat patients, and in fact I was working in Amsterdam and also work in Madrid and in Porto, and there were a lot of patients coming from Italy who had to travel a lot, and I sometimes came to Italy already to work with Dottoressa Favilli in Perugia, in Arezzo and in Rome. And when Mr. Madonna asked me to come and work here in San Rossore, I decided to come and work here to make it better for the patient, that they don't have to travel to the Netherlands, don't have to travel to Spain or to Porto. Basically, I'm specialized in ankle, hindfoot, Achilles tendon disorders. So patients who have pain, who have a limitation of their activities, who have instability of the ankle, they can come and make an appointment and ask for my advice, my opinion on what would be the best treatment for their problem. Well, basically all the treatments that I've always been performing and developed with my team, minimal invasive solutions for all ankle, hindfoot, foot and tendon disorders. So that varies from a treatment for cartilage problems, treatment for ruptures of tendons, overuse injuries of the tendons, of the hindfoot, of the joint, arthritic joints, post-traumatic deformities, so after a fracture, if patients have persisting complaints. And there's a lot of new treatments, not only the minimal invasive treatment, but also new solutions for the treatment of cartilage problems, for tendon disorders. So there's a lot of new solutions to problems of the ankle and hindfoot nowadays. I think my strength is that I put the patient at number one. So my motto is listen to the patient is always right. Meaning that nowadays a lot of surgeons, they treat the MRI and not the patient. I think the most important is to take the patient serious, to listen to what the patient has to say, to investigate the patient, especially for disorders in the ankle and hindfoot. It is not just the MRI or the CT scan that tells the story, but the patient tells the story. And I know by the treatment of many athletes that there is almost no soccer player, when you would make an MRI or a CT scan, that there is no changes. But that doesn't mean that those changes have to be treated. So you have to really carefully investigate the patient to come to a diagnosis and then to the treatment. I think it's a very basic principle, but it's maybe a sort of forgotten art almost. And I think that's the most important. And of course, it's not only listening to the patient, you also have to treat the patient well. And with these minimal invasive techniques, it goes so much quicker. The rehabilitation goes much quicker. The patient can be treated as an outpatient, don't have to be hospitalized anymore. So they're much quicker back to their profession, to their sports, to their level of activity. So those minimal invasive treatments really are a game changer.